Hello, everyone. Good morning, good afternoon, good evening, wherever you might be in the world. My name is Dickie Settle, and I'm proud to host you here today for the future of digital public goods, how coordination today will guide the health systems of tomorrow. My name is Dickie Settle. I'm the Chief Digital Officer at PATH and co-lead of PATH Center of Digital and Data Excellence. I'm also a co-founder of and serve as the ex officio board chair for the global flagship Digital Square initiative funded by USAID, Bill and Melinda Gates Foundation, and 13 other donors. I'm a commissioner on the Lancet Financial Times Governing Health Futures 2030 Commission and serve as co-chair for the Transform Health Coalition, advocating for digital transformation for health equity around the world. At PATH, and particularly in Digital Square, we've been proud to be the vanguard of a new level of investment in and commitment to the digital health global goods ecosystem. Over the last 5 years, we have led 89 investments into 30 global goods, PEPFAR tooling for data and standards development, totaling nearly $27 million from multiple donors co-investing into global goods. Digital Square has been instrumental in facilitating the uptake of HL7 FHIR and tools through the provision of funding and help move the needle on implementability to reduce the load on health system technologists and governments through the Instant Open HIE project. We've seen the formation of the COVID-19 task force with the Open HIE community and the evolution of illustrative data exchange workflows and some formative works that have contributed to WHO's digital documentation of COVID certification and other initiatives. We've had the privilege of supporting tools to become more shelf ready and focus on strengthening core systems and make information more available so that decision makers understand the unique value proposition of tools. And despite how far we have come in the last 5 years in supporting the global goods ecosystems, the next 5 years look even more amazing. And to talk about this future and help us all begin to imagine what comes next for global goods and digital health and beyond, I'm very pleased to introduce our panelists today who are going to be sharing some of this vision for the future with us. First, let me introduce Suhail Bidani. He's the lead for digital in Bill and Melinda Gates Foundation's India office. In this role, Suhail is responsible for the digital and technology interventions across the foundation's programmatic work. He partners with government stakeholders, the private sector, and philanthropic partners to accelerate digital transformation in the country. Next, I want to introduce Fred Hirsch. Fred is the product manager at Google Health, where he works to transform access to essential healthcare through design-led, data-driven technological innovation. Fred works on open source tools for mobile-first healthcare systems and researches how AI can improve access to care everywhere. Next, Dr. Karin Callender is a senior health advisor and chief of the Digital Health and Information Systems Unit in the UNICEF Health Program. She's the co-founder and UNICEF lead of the COVID-19 Digital Health Center of Excellence, or DICE. She's a specialist in childhood pneumonia, digital health and health systems research, as well as community-based primary health care. And then finally, I'm going to introduce Dr. Garrett Nell as the unit head in WHO's Department of Digital Health and Innovation, where he leads research and innovation on digital health. He's worked on many cornerstone digital health publications, including the first WHO guidelines on digital health, the WHO classification on digital health interventions, and the WHO digital adaptation kits. I want to thank you all very much for joining us today. It's really exciting to have such an illustrious panel here to help us shine light on what's to come for digital health global goods. All right, Garrett, let's start with you. You and the WHO DHI team have been, and I love the term you used, beavering away at a really exciting smart guidelines ecosystem with a number of new digitized WHO guidelines, digital services, and digital adaptation kits complete or under development. Can you tell us more about this vision and the implications for how WHO is evolving to meet the needs of global health in the digital age?
Great. Thanks so much, Dickie, and it's a pleasure to be on the panel with all of these panelists from diversity of sectors and partners as well. I think when we think about the role of WHO in digital health, we think about normative content and also supporting enabling technologies and guidance to countries. We find that countries have really had a challenge over the years in, and we've heard this from them, in really making investments into foundational digital systems that have health and data content that realizes their vision for a national digital interoperable, extensible, sustainable architecture that can meet the variety of needs that they have across their whole health system. The challenges that they have are primarily because the systems that they have access to often are developed with a very narrow focus in mind, where they, as systems, they meet one specific need, but they're not necessarily containing all the interoperability standards, or they're not necessarily consistent with the most recent recommendations that come out of our clinical guidelines. And I think for too long, each investment a government has made has resulted in an ad hoc set of digital vertical solutions that that have been challenging to put together and ensure that they can work as a cohesive whole of foundational tools and services for the variety of users, including health workers and their beneficiary populations. Following this sort of realization, I think we recognize that many of the guidelines that we as WHO develop, and we develop about 25 a year, and they contain upwards of 50 recommendations that are clinical, public health, or data in nature, that countries and their digital software development partners really needed easy access to packaged content that was consistent with the recommendations that we provide as WHO, but also that would help facilitate them to adopt and integrate a set of applications and services that would come together and realize the needs that they have across their health system. And so we developed sort of two areas of work in this to really a part of that digitization of the whole ecosystem. One is the smart guidelines approach, and the other is the enabling technologies for that. And the smart guidelines, some of you may be familiar with it, but we work from the starting point of the guidelines that we release, and we make available a set of requirements, documentation, that is in a format that engineers often look to when they're developing software solutions. So that includes the common workflows, the minimum data elements, the decision support logic, the indicators, the personas, and the narratives around what is expected of a specific software application for the use within this program area. And we also align that with a set of interoperability standards to make it easier for the interoperability standards that have been so elusive to software developers as well as ministries to incorporate those into their software solutions. We also ensure that as they are understanding what is needed of those solutions, they can understand that there are services and applications that need to fit together as part of a cohesive whole. So the smart guidelines really provides the content in a way that's consistent with what WHO recommends. And then because of countries really needing to put together these different pieces as software tools combined with the content, we also recognize that as a country is evolving their national enterprise architecture, that they will need to be able to draw on services like identity or terminology services or shared health records, and bring that content alive and leverage software libraries. So the smart guidelines really acknowledges the emerging standard of FHIR combined with the International Classification of Diseases that WHO is a secretariat for, as well as the clinical quality language to ensure that in our SMART guidelines, we make use of all of those standards so that decision support logic can be represented, as well as indicator calculations can be represented, and that as a country makes investments into services and into applications that are intended to be reused, that they can look to that content to be able to be enabled by this ecosystem of software. The software libraries that we really have looked to primarily have come from those around the Open Health Information Exchange architecture and the patterns of investment and use that HIE have also defined. And then we also recognize that a large number of the countries that are investing in digital health for primary care as well as clinical care in secondary facilities are looking to make use of mobile technology as well. And when we started to look at the HL7 FHIR standard, we recognized that there was a gap in the software library. It was very difficult for those who were developing software technologies or either that they had already developed or those countries that wanted to develop their own software products that could leverage the SMART guidelines content and FHIR and the other standards, that there was not an easy to use software library that would enable them to deploy on Android, for example. So we reached out to a number of software companies and asked them what would be the requirements to enable that or to define what the software library would look like. And we reached out to colleagues on the call, Fred Hirsch and Google, and we said, what would it take for you to listen to the broader software development community and to make available a software library that would enable those who would be wanting to develop mobile applications that would leverage the SMART guidelines? What would it take for you to help to build that software library for the global community? The last part I'll note, and I'm sure Fred will talk a little bit more about this, I hope. The other aspect is we recognize that as countries were wanting to make use of and think about SMART guidelines, they wanted to have terminology services, and they wanted to ensure that there was a consistency in how products were recognized and classified. ICD does this part of the way, and we've also been working on terminology services that contain the SMART guidelines content, and we'll make those available to software developers and governments. So we see these as the enabling services as well as the content. The last point I'll make is that the enabling technology needs to be have a complementary set of tools and services that will enable someone to bring a product to a testing suite or a sandboxing suite to see whether their prototype session is going to be able to interoperate within this ecosystem and follow the same patterns that they would expect and be able to exchange data in the consistent way. So we see the SMART guidelines combined with the enabling technologies as being a set of tools that are supported as global goods for those who are at country level who are wanting to adopt health and data content as well as solutions that are consistent with what WHO would recommend. And Dickie, I'll hand back to you. And I'm sorry, probably a little longer than you expected, but thank you.
No, you're just fine. And let me just come back at you with a follow-up question. This ecosystem that you've described from our conversations, from what I understand, is going to be supported and reinforced by an envisioned WHO Digital Health Clearinghouse. How will this new initiative support member states and encourage the incorporation and adoption of SMART guidelines and other standards and best practices as you've just described?
Great. Yeah, no, absolutely. As countries are wanting to identify solutions that are consistent with standards and recommendations, they're going to want to feel confident that when they're seeking these solutions, they can find an easy place to find products that have been assessed and that are curated. against that. And the clearinghouse is really intended to reach out to the global development community and provide specifications and these interoperability standards, and ask them to demonstrate that they, number one, will be able to exchange data using these interoperability standards. And number two, that their functionality, clinical and data content is consistent with WHO clinical recommendations or public health recommendations and data indicator recommendations. The other aspects that we'll look at are aspects of, is it implementable within resource-constrained environments? And is it financially sustainable within environments like low resource settings? And then lastly, we'll look at aspects of data privacy, security, and the safety of these solutions. And so the clearinghouse will really represent a set of applications and services that are consistent with specifications, including the SMART guidelines, but also interoperability specs that we hope that countries will be able to plug in like Legos into their building block digital systems that they have at country level, and that they'll be able to, in a modular way, add or remove services as they see fit. So the clearinghouse is really meant to represent that health and data content aspect in the global digital goods, public goods ecosystem of that we are all, I think, contributing to. Thanks.
Great, fantastic. Thank you, Dr. Mel. That's really an extraordinary vision to describe the richness and thoroughness of the WHO SMART Guidelines ecosystem and the various standards and approaches you're promoting, as well as the application of this digital health clearinghouse. We've all seen how WHO's pre-qualification activities have really shaped the ecosystem of available medical devices, diagnostics, medicines, vaccines, really shape the tools that are available for the world to bring to apply to health challenges. And it sounds like this digital clearinghouse is going to provide that same level of market shaping to help really engage, support, and incentivize digital developers to take up the many standards and guidance that we're all working on together. Let's take a step a little bit deeper, if we might. And Fred, I can't thank you enough for staying up and joining us from Singapore and bringing us the perspective from Google. We've heard from Dr. Mel how he's worked with you to identify and start building some of these software libraries, and really just excited to hear about this new approach at Google to support global digital health. The recent Lancet FT Governing Health Futures 2030 report that I referenced earlier advocates for an individual rights-based approach to health data ownership, as well as a trust architecture that facilitates the sharing of individual information. What are Google's plans for supporting these recommendations and the vision that Dr. Mel outlined?
Great, thanks, Dickie. And first of all, I just want to say it's great to be joining all of these esteemed panelists on the call this evening, and thank you to the organizers as well. And I'm really excited, and it's a real pleasure to be here to represent the work that we're doing at Google to help the global digital health community realize its vision. I think, Dickie, you kind of painted a really nice picture of that in the beginning, but its vision of an open, accessible, standards-based global digital goods for health that can really drive the field forward. And so we, Google, we're really excited about the adoption of FHIR, which as a standard we've been supporting and promoting for a number of years now across different healthcare efforts. And the work that that Garrett talked about, that we've been doing in collaboration with the WHO, is a great example of this, where our teams are building infrastructure. In this instance, it's an Android FHIR software development kit to really make it easier for developers to build offline capable mobile first solutions or mobile health applications that utilize the FHIR standard and that can run FHIR content like the WHO SMART guidelines, which is really about how can we help to bring access to evidence-based recommendations to the point of care, and then how does that drive future healthcare systems. And through this collaboration that Garrett touched on, we're really excited about the potential or the opportunity for this to help countries to realize SDG and UHC goals, right? In particular, the opportunity for digital health to help to support this integration of community health workers into coordinated primary care, which we see as a vital link in bringing greater access to care into communities and addressing existing health equity gaps, which the Health Futures report touched a lot on. And just to be clear, our role here, and we see our role here very much as it's an enabler of this shared vision that Garrett and others have articulated, and we want to really see this to help countries accelerate the achievement of their digital health plans and goals through making it easier to adopt open standards and mobile-first approaches. And just I want to point out that when we talk about this work that we're working on, at Google, we're not collecting any data as part of this. This is really about releasing open source tools for the developer community to be able to then build locally relevant solutions, as Garrett pointed out. So to maybe kind of address some of the question as well around the digital health futures, I suppose first of all, just to say congratulations to all the commissioners and the writers. It is a really interesting report, and I suggest if anybody hasn't read it, it's definitely worth reading, and it lays out an exciting future for for where digital health is going and the opportunity for this, for how as a society, I suppose, we come together to try to really make the most of the opportunity. So in terms of an individual rights-based approach to health data ownership, at Google, we believe that privacy is an individual right and should be protected through privacy and data protection laws, right? So we believe that all personal data, especially health data, should be protected and that individuals have control over their personal data. And then, moving on to this question of a trust architecture, there was a lot in the report around, what that means, and I think, kind of unpacking that. And I think something that really spoke to me was, was this idea of, how digital transformation should really enable health for all. And I think this is very much kind of aligned with, our beliefs and how we think about the work that we're doing in the global health space here. And that's really about, how does digital transformation help to address equity gaps, is developed and is ethical in its implementation, is inclusive and obviously respects individual rights, for example, respect to privacy. And so, maybe kind of without unpacking all of it, I think an important question that we certainly, ask ourselves and think about is, well, how do we ensure that these advances in technology, that we've seen kind of drive digital transformation in other sectors, whether it be digital health tools or artificial intelligence, how do we really, try to ensure that these benefit all, right? And that they're basically, that we're using them, to enhance, health for all, and very much to kind of close equity gaps that exist. And I think this aligns closely with the way that we think about our work broadly in the healthcare space. So from our AI principles that guides a lot of the research that our teams are involved in, to building open source technologies, right? To be enablers. We want to ensure that the benefits of these technologies are going to be available to everyone in as wide a possible way. And again, the fire SDK work that we're talking about with the WHO is another good example of this, right? By making, we really believe that by making the fire standard more accessible to developers, we hope it will enable local development of solutions, using commonly available technologies that are building on open standards. So by making it easier, to build around this like technical specification, we can empower developers anywhere to be building, locally relevant solutions. And in turn, we see this as being kind of, I suppose, an important component of really like helping countries to have control not only of the design and the, of their e-health strategies, but actually the implementation and the kind of the ongoing, sustainable, having the capabilities to be able to sustain that going forward. And I think, just a couple of other points there, as the report highlights, there's a lot of potential, obviously, for harnessing data as a global public good to help us to improve our collective understanding of disease and opportunities to intervene earlier and prevent future pandemics. I think, how do we enable these health futures ultimately through a mix of appropriate regulation, thoughtful policy and innovative technologies, and how we ensure this is done in an inclusive, equity-based way is going to be an ongoing discussion and a space that we certainly look forward to contributing to. Thanks. I'll hand it back.
Thank you. Thank you. This has been, I have to say, so exciting for me as we worked as commissioners on developing the report recommendations, to also be following along with the work that you've been doing with WHO, and just watching, even as those recommendations were being developed at the, as you said, society, socio-political level, to see this technical engineering that's going to lay the foundations, the underpinnings to help realize those recommendations. And so I'm very excited to be bringing those forward today in our conversation to our community. Karine, I want to shift a little bit. We've been digging pretty deeply on the supply side, really speaking, I think, to developers and the future of the technologies of the global goods. But of course, we can never decouple that from the demand side. And so I'd like to shift us over and talk a little bit about that demand side. Earlier this year, in collaboration with WHO, UNICEF launched a new Digital Center of Excellence, or DICE. Can you tell us more about this new initiative and how you're supporting countries in the digital response to COVID-19 and beyond?
Sure, absolutely. So the DICE mechanism, the DICE idea is really only a couple of months old. And it started basically as a result of the COVID vaccine rollout preparations. And, there's been a lot of new partnerships forming across the multilateral organizations to really prepare for this massive sort of new monster of vaccine delivery that we had to deal with. So as part of that process, there was a COVAX working group formed that was called Innovations to Scale for COVID vaccines, which was a WHO and UNICEF-led sort of initiative that met weekly starting I think we started last year in October. And it was very clear that what we need here is not necessarily new innovations, but what we need is to really support countries to use the systems that they already have, the digital platforms, the data management mechanisms, and adapt those to the COVID vaccine rollout. And it's really about now trying to promote those mature digital solutions that exist so that we don't end up with another situation that we had in West Africa after the Ebola, whereby a lot of new solutions, untested, solutions which weren't following standards were sort of thrown into the country. And the country they weren't able to sustain them, and most were not used after the epidemic ended. So we were trying to prepare for this situation by forming different working groups that would sort of align around best practices around a number of unique challenges that were completely new in relation to this COVID vaccine. Garrett's been leading a working group on the digital vaccine certificate. There were working groups looking at tracking and tracing of the vaccines, micro-planning using geospatial mechanisms. Anyway, all of these working groups kind of created these best practices, but we realized there is a lack in sort of now linking all this work that's been done, both using the support to using global goods to support the benchmarking and sort of best practices around solutions that can be used now in-country systems to address the vaccine rollout, and linking that to the funding that is available to countries. There are a lot of donors who now appreciate the use of data and digital and the importance of having more real-time data coming in. So we had sort of a funding sitting at the donor level available to countries to apply for. We had the best practices sitting, sort of technical expertise being available, guidance. And then we had the countries themselves in the working groups at country level who sort of obviously often there's so much going on and they weren't aware of neither the funding or the technical expertise and best practices available. So we said, why don't we form a mechanism where we can connect all of this, connect the countries to the funding, connect them to the technical expertise and best practices through sort of a collaboration initiative. And that's what formed the Digital Health Center of Excellence. And the idea really is to improve that collaboration and coordination around technical assistance to national governments and support them to use the existing solutions or best practices to address COVID-19 pandemic response, but really looking at how these solutions not only can support the immediate priorities for COVID, but actually build them, design them, and sort of set them up in a way that they can strengthen the health systems more long term. And what I mean by that is sort of if we were to introduce a solution for COVID vaccine monitoring at individual level, of course, we would love to see that being expanded to EPI or routine immunization at a later stage so that we don't end up with different COVID-specific solutions that are completely working outside the digital health ecosystem or the health information system, but that really fits as one of the pieces into a more holistic health information system. So with that was sort of the aim, what we were striving for. And we set up DICE as a multi-agency consortium. So we have a number of donors and partners that we meet with on a weekly basis who discuss country strategies, country needs. It also is a mechanism really to operationalize this digital investment principles. You know, we have these principles that were formed 3 years ago, which were really meant to improve the donor coordination around country strategies and country priorities. And I see this as really the operational arm of that, to be able to say, this country has a need for a system that does X. And we then look at who are the country teams working to support at country level. We don't want to bypass the existing structure. So it's really about encouraging and inspiring the teams, the CDCs, the USAIDs, the UNICEF, the WHO colleagues at country level to really align around a priority area and come up with sort of a plan for how to address it. And in the countries where now DICE has been able to we have received requests from the governments, we are quite clear that the request should really be endorsed by the government. We can't just address any request coming in from any NGO or any UN organization, but it has to be something that the government sees as a priority. And when those requests come in, our first question is always, has this been discussed between the partners? Is someone doing something similar? Because oftentimes you actually find that there's already someone else trying to address this problem. So it's really about trying to first make sure that this is definitely a gap. And then we look at how we can support that through technical assistance. And the goal, the ultimate goal of this mechanism of DICE is to ensure that we have that there is a technical assistance is available to countries who want it, to use sort of more sustainable solutions that are addressing sort of the health system's needs more broadly, while they also address the immediate COVID needs. And why we think this is needed is really that even we saw, especially when COVID started, that there were, we had the digital public goods community already gearing up with a lot of excellent sort of modifications of their solutions that could be used for COVID. At the same time, we have a lot of private sector providers coming in with sort of tailor-made or sort of bespoke systems that had been developed perhaps in the US and never tested on the African continent, being sort of pushed to countries. And we really wanted to make this offer support to enable the governments to choose better and to choose the systems and solutions that would best fit in their context. I hope that explains, Vicky.
It's perfect. And it's really compelling to hear about the the vision and the opportunity of DICE to really, if you will, aggregate that demand and begin to create a more coordinated approach and mechanism for operationalizing the donor alignment principles in digital health, as well as the digital development principles. So thank you. Now let's tie it back to Garrett and Fred's comments. As you listened to what they were describing, whether between the ecosystem of the SMART guidelines and its guidance and support, the digital health clearinghouse to really help incentivize and encourage and support the adoption of these standards and guidance, and listening to Fred describe what Google's doing to really help enable technically through the SDK and the libraries that can support these things. What excites you most about this growing vision, this next level, if you will, on the supply side of global goods, as you've been listening to and thinking about the country needs?
I mean, I think for me, it's that the main excitement on my side, and this is something I've been asking for so long, and I think now it's finally happening, is the reshifting the focus away from open source software. We have some really great open source softwares out there, but of course we always need more. But now the focus is shifting to more the other open source sort of areas that we know. A digital public good is not just the software; it's open content, it's open standards, it's open AI models, it's open data. And I think the open content in particular is something that I've really been trying to promote more, because countries that have open source software could really benefit from having more open content. There's so many times that, there's reinventing the wheel over and over and over, because that sort of content, workflows, training guidelines, like messages, anything that has been showing to work in a country, it's not necessarily available to countries who have the same problems. And just having, I've personally worked with a country that was designing a health worker sort of decision support algorithm from scratch. It takes years to get that, to move from a paper-based workflow manual to a completely electronic version. Even though it seems pretty straightforward, I think it took us 2 years to do it, and also agree on what exactly is the best practice in terms of clinical practice. And I think having those workflows and the SMART guidelines will really, really speed up that process. And not just looking at which technology can deliver this, but based on the technology that they already use, how can we adapt the content to that? And I think it's just going to make work much more more flexible and be able to sort of introduce these systems more quickly. I think there are many other areas where I think open content will make a big difference. And a lot of this comes down to demand generation, messaging, for example, health worker training. Another area we've been investing in a lot during COVID is to take all the excellent training content for health workers that's come out of Open WHO or other resources and make them available on various platforms that countries are using, like SMS or Telegram or WhatsApp or Moodle, because it's not necessarily, that the technology that holds them back from being able to deploy. It's having that vetted content available in whatever format they need. And those types of initiatives, I think we need more. But I'm really glad to see this happening, especially for the workflows and the SMART guidelines. And in terms of the clearinghouse and sort of this software libraries, I'm really excited to see these. We always talk about digital public goods, global goods, and open source, but I actually think that these initiatives can also inspire the private sector providers to align better with our standards. I don't think we will ever see everyone going open source, even though that's what we would love to see. But it might at least inspire those vendors who may want to protect their source code, but at least to make sure they align with best practices when it comes to interoperability, when it comes to the content. Because the worst thing, like the thing we absolutely don't want to see, is decision support guidelines that don't follow WHO best practices and that actually could cause harm to a child or a mother. So at least if we can inspire the private sector and the public sector to align with the same content, the same standards, even though they might not be considered global goods as a result of their licensing code. But I think that's an area where these initiatives could also make an impact.
Thank you, Dr. Callender. That's good thumbs up from Garrett there. I think your call out to vendors who may be resistant to making their licensing open should at the very least do what they can to take advantage of and to promote the open content and the guidance and the amazing resources that WHO and other partners in the community provide, but also open standards. Rather than putting too much effort into proprietary standards for exchange, committing to understanding and adopting the open standards that's being promoted by the WHO ecosystem and will be a key part of evaluation in the clearinghouse is also very important. Okay, I want to take a moment to reach out to our audience who've been listening very intently. You have the opportunity to put questions in the chat. We're going to be shifting to some, I see some are already coming in, fantastic, to some open questions and discussion moment. And as our inaugural discussant, I'm going to turn now to Suhail Bidani. Suhail, the Bill and Melinda Gates Foundation has been such a remarkable, substantial and catalytic investor into global goods. That includes the global goods ecosystem that we've been talking about, includes DICE, it includes Digital Square. I don't think there's any part of the conversation so far that the Gates Foundation has not substantially invested in. You've been sitting very patiently listening to a clear vision for the future, spanning the supply of these technologies to the demand from countries for global health in the digital age. What are your reflections as you've listened to the previous speakers? How close or how far is that vision from that of the foundation?
Thanks, Ricky. First of all, I just want to acknowledge that I think the composition of this panel itself represents the required collaboration and partnership that we need between various stakeholders, including the private sector. It's really exciting to see how Google, WHO, UNICEF, and many other partner organizations are coming together to solve for some of these problems. And in fact, just to reflect back over maybe a decade of my work in the digital health space, I remember how technology used to be seen as potentially just digitization and an enabler to where we are today, where everybody believes that digital-led transformation has to be the focus, especially with respect to the healthcare service delivery and the primary care component of it. And if at all there's been any good from the pandemic, is the push around digital health agenda across different countries, and especially in India with the National Digital Health Mission getting announced and the government really backing it up. I think it's really the only positive that I see from the pandemic. I share the excitement Karen shared about the smart guidelines, WHO clearinghouse, some of the great work that Fred talked about that Google is supporting. I think it's extremely important that we enable the ecosystem by ensuring that some of these components are available to them. Nobody's reinventing the wheel. The Android Fire development kit for mobile solution is superb. I mean, I'm really grateful that somebody's taken it up and releasing the open source tools for the developer community. There were a couple of things that some of the previous panelists talked about, and I just wanted to expand and bring the Indian context just as an example, but I think it applies to most countries, definitely countries which are just embarked on their journey around digital health. I think this point around trust architecture is a critical one. While we understand and appreciate the importance of privacy being a right, I think what we are also concerned about is how do you bring that balance between, and it's a constant debate, between privacy and public health as a key driver for the government to be focused on and supporting some of the consent-based architecture that can be introduced to make that happen. We would love to see how different countries are addressing this issue, because this is as applicable in the US as it would be in a country like India, or for that matter, any country in Africa. There was also a point Fred made was, he made around how digital health can address equity gaps. I think access being one of the key parameters along with quality of service. If we are able to get going on certain aspects of or leveraging digital to address these two critical components of healthcare service delivery, I believe we will do a lot more good than in terms of just looking at it purely from a digitization effort. There was a point around open source software that Karen was mentioning, and I completely agree with everything she said. Just to add to that, I feel equally important is the ecosystem development when it comes to open source digital goods. I know there's a lot of effort being put in by Digital Square in that direction, but it's a chicken and egg story, right? I mean, we see a lot of good solutions in the open source space, but not enough players available to play that role of a system integrator or a managed service provider. The more we are able to bring an ecosystem development approach around each of those solutions or platforms, it will enable a higher level of adoptions. Because at the end of the day, for sustainability, government would want to engage with a partner organization who could give that support to them. And almost every government would have their own procurement rules and policies to follow. By having that ecosystem, it enables and facilitates that particular part of the jigsaw puzzle to be solved. Just one example that I wanted to bring was around what Karen was mentioning in terms of how DICE is trying to ensure that something that is available with one country is offered to another country. And I think that's something which is, again, pandemic and the solutions that came up are a good example to pick, because vaccination certificate, the whole credentialing part of it, we all understand is extremely important for any government across the world to look at. And there are already good solutions which have been developed by different countries, different organizations. How do we ensure that some of this is offered to countries which are just starting their journey on it, and they don't have to start from scratch and building these solutions? That would be an important piece of focus that DICE could bring in, an organization like Digital Square could bring in. But overall, I'm just pretty excited about all the work that is happening, and how can we ensure that all the required resources are available for this community to sustain, and this partnership and collaboration to sustain. I think that's where we see some role that as Gates Foundation we can play. We have a limited role, to be honest. All the heavy lifting happens by people like Garrett and Fred and many others. Just very, very pleased to see all this development, and look forward to more coming from the team. Thank you.
Absolutely fantastic remarks. And thank you so much, Suhaila. You've really helped move us into this Q&A discussion part of the session. I see we have one question that's come in from the chat. What data do you use to help you understand the landscape of systems and other digital goods deployed across the country's programs that you support? It's difficult to prioritize data systems interoperability use cases without understanding what is already there. And to thank you to all the panelists for an excellent session. So let's see, let's start with Dr. Chalander. Could you give us a bit of a response when you hear that question?
Yeah, no, it's an excellent question. And, there have been many attempts.
You fell back on mute.
she does that. There's been many attempts to, to in the community to have a good overview of what countries are using already and which systems are implemented. We have the Digital Health Atlas as a great example where, there's been a platform developed to sort of make sure that initiatives are recorded but there are challenges with that. It's sort of not necessarily up to date, and it hasn't really trickled down to all the implementers and governments to enter their data. So another sort of one-off initiative that was done earlier last year was by Path and Digital Square, together with USAID, was to do a map and match assessment specifically for COVID, really, to see what systems countries were using. They did this for 23 countries to understand which systems were in place that could potentially be adapted for COVID. And if you haven't looked at the map and match resource, I really encourage everyone to go to the Digital Square website and search for map and match. There are excellent country briefs available for those 23 countries. We also partnered in UNICEF, we partnered with Digital Square to extend this map and match exercise. So anytime a country reaches out who would like some sort of digital health support under DICE, we now begin with a consultation around sort of what systems do they already have in place. And I hope we can share some links in the chat to the audience during this call, but there is a UNICEF site where we also have landscaping assessments for a number of countries where these consultations have been done, which also map out solutions across the health systems functions and the digital health classifications to see what countries are using today. And it's true that it hasn't sort of, what we're now really striving to across these initiatives is to make sure all that data feeds into to the Digital Health Atlas as the ultimate sort of home for this type of information. But in the meantime, I would encourage everyone to look at the map and match and the UNICEF landscaping assessments.
Great, wonderful, fantastic. Garrett, your hand is up.
Yeah, I just want to, it's been a great panel so far. Thank you so much, Dickie, for you and Pat putting this together. Maybe just to note, I think, Sahel, the point I think you raised is really important, is that there are a huge number of really important solutions that are coming out of countries that are, and I think India is a great example where, CoWIN, Divock, Aadhaar, I mean, these are amazing systems that are, in the case of Aadhaar, it's an identity management system that is, used at a national scale for over 1 billion people. I mean, that is remarkable. There's a digital wallet for your health record. That's amazing. CoWIN is, an integrated system that integrates Aadhaar, a digital wallet, demand generation and management of vaccine solutions, and integrates Divock for certificates. India is, I would say, a leader not only in the architecture at a national scale, but also in, as I understand it, their early adoption of FHIR as how they're building how they're thinking about standards being at the foundation of what they're doing now. I think it's really exciting, and it's also exciting to see that they are, as a country, trying to determine how those solutions may be appropriate in other countries as well, and have reached out, I think, to the digital health community to understand and help through that translation, technology translation process of how other countries can adopt those systems. I think that's a really exciting change in the landscape, and I think increasingly, I think we're going to see a lot more solutions developed by countries that have, have a very capable digital workforce, that are in a position to be able to help to ensure that those systems are made available elsewhere. We at WHO very much welcome the exciting trend that I think will result in more countries being able to maintain and support their own systems, and have others that may be in a similar state of digital maturity as a country to be able to refer. I think we'll start to maybe break away, and we'll have more digital equity, I think, among countries, and hopefully lessen the digital technology debt that some countries have faced so far with legacy systems that they haven't built themselves, that they are really a challenge to upgrade and bring into the new era of standards. So we very much welcome not only India, but when the work around the digital certificates for COVID was evolving, there were a large number of software development, software solutions that were coming out of a much broader set of countries than we would have otherwise expected. And in our case at WHO, we were very much aiming to ensure that there was a specification that would help to facilitate and maybe market shape so that there was an interoperability standard. But great point and great comment, and I'm sure that the Gates Foundation has been partly helping behind the scenes, perhaps in India, to help evolve the thinking there. But it's really impressive to see how the National Digital Health Mission is really becoming a powerhouse. So thanks.
Great, excellent. You really brought up a key point there, Garrett, that even as we've talked about the global goods ecosystem, this new emergence and what I would call real success of the global goods ecosystem is seeing both global goods get adapted into local goods, and even more importantly, beginning to see local goods beginning to emerge that can now be identified and ideally adapted into these open standards and the kind of implementability approaches that WHO is recommending to become global goods themselves. And I think that's where we're going to see the ideal state that we're all trying to work towards in this global health in the digital age. All right, we are coming up on the last few minutes of the panel. It's that time to shift to closing remarks and call to action. And so I think you've each got about a minute. We're going to start in reverse order. I'm trying to give you as much warning as I can, Suhail, to be ready. And then as we came into this conversation, and so from each of you, in a minute or less, you've got the entire audience of the global digital health community here. How can they begin to really engage and contribute in this coming future? Suhail, we'll start with you.
Thank you. And I'll just make 2 points. One, we took the example, Garrett talked about COVID. One, I'll encourage everyone to not just look at replicability of a particular solution to another country, but also try and apply that thinking and see if we could leverage it from a different context. Could be a vertical program, and I'll just take COVID as an example for now. I don't think we should restrict COVID only for monitoring and managing the COVID vaccine drive, but in a more broader sense, look at routine immunization itself. I think that's equally important. We should not forget we still have very significant health goals to achieve globally, and each country has a role to play. That's just one example, and that will be very critical. Second, I've always requested everyone that there is a lot of advocacy still required. Not because the intentions are not there, it's the lack of understanding in many cases. And I believe advocacy is not the job of a particular organization or set of individuals. Each one of us has a role to play, and we should just keep creating more awareness and education and ensure all the myths around open source and digital public goods that are there just go off. Thank you.
Great, fantastic. Next, Karim.
Thank you. I also have just maybe 2 points I wanted to highlight, and they're maybe for different levels of the digital health community. But one being, I mentioned earlier that I've really been maybe a bit frustrated by the lack of open content. And now I think that is being satisfied. I think I see there's so much more coming out there, but I don't think it's enough. So I would really encourage the community to share more of any sort of content that goes into the digital platform. Share that so that it can be more quickly adopted across platforms. But also, even I would love to see in the future more sharing around data models, AI models, things that could really speed up and improve the use of data. We're pretty good at setting up systems to collect data, but there's still a huge underutilization of data coming in, and platforms and sort of visualization tools that can make data more actionable at the local level. And here, I think, we have a great need for sort of open data models that can identify and prioritize sort of and target populations or health interventions for specific populations. We have a great need for AI models that can quickly identify settlements or health facilities from satellite images, anything that could speed up, whether it's COVID vaccine rollout or identifying zero-dose children who haven't been immunized, any of kind of tools that can now be used on these digital platforms, across platforms. I would love to see more sharing and development in that space. And then just my final sort of plead is that we work as a global community to not reinvent the wheel and implement sort of fragmented approaches at country level. I really encourage everyone to always look at what's on the ground, what can be adapted that already exists. If there's nothing that is sort of suitable to be adapted, what can we learn from other countries that have worked, rather than sort of starting with these new pilots and new initiatives that with untested solutions. Let's really try to build these systems and solutions more sustainably as we go along.
Fantastic. Fred, you're up.
All right, great. I think those are wonderful closing remarks, and I think to just try to maybe build on some of it, which I think vehement agreement of all of that, is as we think about like growing the ecosystem, through sharing, by building across open standards, by being able to kind of share some of the components. One of the things that I really think a lot about is how are we kind of reducing that kind of the technical complexity, and how potentially can, by kind of thinking about almost like the iceberg, by having a lot of that taken away, how can we as an ecosystem, as a community, how are we kind of driving innovation in kind of some of that like last mile design and delivery, which I think is going to be critical to creating these next generation or leapfrog type technologies that are going to really deliver that increased access that Suhail talked about, but also be able to leverage this content and open standards to drive better quality.
Fantastic. Thank you very much. And just really appreciate, again, you joining us today. Great words. All right, Garrett, Dr. Mel, you get the last word. Please, if you don't mind, close us out.
Great. Thanks so much. It's been a pleasure to be on the panel. I think maybe just to echo, I think what others have said on the panel, that this space is too complicated. There's too much for any one party to do on their own. We all have, I would say, a complementary role. I think when the principles for digital development and the donor development principles were developed, I think they reflected that fact of when investments are taking place, they should be coordinated. The reuse of systems, or at least the architecture, needs to acknowledge the need for extensibility, for the ability to not have to reinvent for every subsequent problem that you're faced with, but rather to think at it from the beginning, to think of the future of national scale and data exchange and reuse from the start. I think I would advocate that we don't continue to reinvest in systems that aren't architected well and just become mud architecture that just evolves and agglomerates new functionality, but rather let's rethink this space, the AI and the all the features that I think we're alluding to in this panel will require ensuring that countries do architect adequately, that they have the right content, they're using standards, and they're really thinking about the diversity of uses. Reuse of old tools and just adding to them, I would say, is not necessarily a helpful thing. So I do think we need to reassess what's already on at the country level and help countries to bring themselves out of technical debt if they have it. But it's been a pleasure, and we're happy to help in any way we can. And I would just say on the software development kit and on the SMART guidelines, we do have resources on WHO. There is a weekly working group. I would just encourage, if people want to contribute to Google's software development kit, we'll make available links. I know Fred and his team are probably putting up a blog in the next couple of days to provide a bit more detail about the SDK, and we'll do the same on our side in case people want to join and contribute to these efforts. So thanks again. Back to you, Dickie, and thanks again.
Thank you so much, Garrett, and all of you. Fantastic closing words. I won't do any more except to thank you all for making the time today to share this extraordinary vision of the future. As I said at the beginning, we've come so far in the last 5 years, in many ways galvanized by that 2014 West Africa Ebola response. I think we've seen that response to COVID be very different, thanks to all of the work that you and so many of the partners and global goods developers and implementers and government stakeholders in the community that have been a part of defining our vision of the present, which was once a vision of the future. You've now let us look into the future ourselves and see what the next 5 years are going to look like, and help provide some very clear and concrete recommendations to our community of how they can engage and get involved. To our listeners, thank you for staying with us while we went over a little bit here. If you want to hear more from Garrett and Fred, please join them tomorrow at 12:30 p.m. GMT for the Driving Interoperability and WHO Recommended Digital Content with a Fire-Based Smart Ecosystem, to get into even more specifics and details of the work that they've been doing. I also encourage you, if you were interested, to speak by the Lancet Financial Times Governing Health Futures 2030 Commission, its report and recommendation released in October. There's going to be a panel here in a couple of hours, and I'll be back on the virtual stage with my colleagues to share more on that work. And so with that, thank you all, listeners, speakers alike. It is so wonderful to be here with you, and we'll catch you around the bend.